Hello everyone, I'm Dr. Sean, a sports orthopedic surgeon committed to helping you stay active and healthy. Today, I'd like to talk about something that's increasingly important as we age, degenerative tears and why they can be challenging to repair. As we grow older, it's natural for our tissues to experience wear and tear, just like a favorite pair of jeans that wears thin over time. The meniscal tissues in our knees also weaken. This weakening can lead to degenerative tears, which often develop complex patterns across the meniscus. These tears often extend into the white zone, an area with minimal blood supply. Because of this lack of blood supply, healing becomes difficult, even with surgical repair. While we can technically repair the meniscus, surgery doesn't restore its original strength. If you continue high-impact activities post-op, there is a higher chance of re-tearing. That's why modifying your activities after surgery is crucial. Incorporating low-impact activities can help maintain your knee health without overloading the repaired tissues. During surgery, we usually trim away the unstable, torn fragments that are unlikely to heal. This step is important to prevent further damage and alleviate pain. Once the unstable parts are removed, we can then focus on repairing any stable sections to preserve as much of the meniscus as possible. Considering surgical treatment promptly is essential. Addressing degenerative tears can relieve discomfort, improve knee function, and prevent further deterioration. Imagine returning to your daily activities with greater ease and confidence. As for recovery time, it varies for each individual. Many patients begin gentle movements shortly after surgery and gradually resume normal routines over a couple of weeks with the guidance of physiotherapy. If you are experiencing knee pain or suspect a meniscal tear, I encourage you to take action now. Your journey to healthier knees starts today. Let's work together to keep you moving forward.